Welcome to Patient Management System by DTS-INC. This patient management system is integrated with HL7, Health Level 7 International, that is the global authority on standards for interoperability of health information technology. First of all, patients can register themselves online for the appointment. This is our home page. Patients can register themselves online for the appointment. A patient can enter his name and all his credentials, father's name, gender, his address, contact number, an appointment date, he can also select doctors from our list of doctors. When patient submits, his data is saved. This is the admin view. The admin can log in on the home page. In his view, he can see all the details of the patient management system. He can change details of staffs, diseases, appointments, patients, wards, and reports. Here we will show you how to add a doctor. The patient can add a doctor. The admin can also select the doctor's schedule, working time, and the maximum patients he wants to see. He can also edit information for any doctor or staff. He can change doctor schedules, their timings, and the number of maximum patients he can see in a day. When he clicks on submit, all this information is saved. Here we are showing you how to edit the address of a doctor registered at the patient management system. The admin can also add and edit staff information. This is the form to add staff. You can see all the details the admin can enter. He can also edit staff information. He can also edit or add information about diseases. Here we are showing you how to add a disease. The admin can write the name for the disease and click on submit. This disease is added to the patient management registry. He can edit or delete diseases. Now is the appointment view. The admin can change or delete an appointment. He can also change a doctor schedule for the appointment. He can also add his own appointments if they are not added by the patient. Here is the patient view. From here, the admin can edit, add, or change patients. He has to enter information regarding the patient, like name, father's name, address, profession, medical history, and prescriptions. From the disease select menu, he can select the type of disease that the patient has in his medical history. He can also add previous prescriptions for this patient. If the patient has to be admitted, he can also add the name of the ward that the patient can be admitted to and the number of the bed. The admin can also edit a patient's information. He can change the username, the password, or any other information about the patient. The admin can also change, add, or edit ward information. He can also add a ward if a ward is added to the hospital. He can write a new name for the ward and select the type of ward. This ward information will be shown in the admin view. He can edit the ward information later. For a selected ward, he can see which of the beds are occupied. He can add bed details, descriptions, per day rent, the staff selected for the ward, bed status, and other information. As you can see, the ward information has been edited. He can also edit other wards information. He can change ward status and bed status. This is the reports view. The admin can make a report. For example, here we are showing you how to make an X-ray report. The admin can write a description and charges for that report. He can edit that information later. Or delete that information. This is the doctor's view. The doctor has to enter his username and password at the home page. He can edit his information like his working days, his schedule, and timing. He can also edit his appointments. He can view his appointments. The details for each of the appointments are shown. This is the patient's view. A patient who has registered before on our website can log in using the required username and password. Here the patient can view his medical summary. He can view his medical history, his past prescriptions, and other details.